So please share this information to your contacts to join. Happy Sunday to you guys. Hello, family. Welcome to Healthy Living Global. All right. So this is life. Thank you very much for being part of our Healthy Living community once again. So please try as much as possible to share videos, subscribe to our YouTube channel. Yes, subscribe to our YouTube channel so that we can get this goal, we can achieve this goal together, right? So very, very important. You need to achieve a goal. You need to achieve a goal. So now we want to discuss, let's continue our discussion, take it one after the other. We have discussed about what leukemia is, right? Now, let us continue. The next thing on the line is, how does leukemia affect our body? All right, how does leukemia affect our body? Let me see. Is anyhow we can share? Let us share this because we need more people to join us on this live. More people to join us on this live, right? Okay, now let us continue. It's fine. We say, okay, how does this leukemia affect our body? One is that leukemia cells will outnumber the good cells in our body. And what? Leukemia cells are useless, all right? It's not functional, but it will just do what? Take the space of the body, and that is in the bone marrow. So they are very useless. So that's how they, and now, as a result of this, the normal blood, red blood cell that's supposed to carry oxygen and other vital material into the body, into the organs, the tissues, will not be enough. Therefore, there will be an insufficient oxygen, all right, that will reach all those areas, and it's a problem. White blood cell, we know the function, fighting of infection. It can no longer function well because it's very few in the system. The leukemia cell have actually taken enough space, so the body cannot resist infections easily. So means the immune system is down. Then what about blood platelets? That's why one of the signs or signs and symptoms of this leukemia is bruising easily and even bleeding easily, especially nosebleed. In fact, even when you have wound bleeding to the skin, you see dark patches, sometimes yellow patches on the skin, bleeding to the skin area. Call it petechia. All right, so don't mind us. That hurt workers for you. So have made some names of which we call all those kind of conditions. So now that's how leukemia can actually affect the system. When you take enough space, all those cells cannot work fine anymore. So it will not be enough to run the body. So therefore, the immune system will go down. The body will be weak, cannot perform some function because of what is down already. The blood cannot clot as expected. So that is it. So it have taken a larger portion in the body, and they are useless cells. So the next thing of which we talk about, for the sake of time, we talk about the types for the little interruption. All right, so now I say we can classified based on the type of cells of which is coming out from, and we can classify. All right. So based on how the worsens easily, that is how fast it goes and begin to destroy the system, and also based on the type of cells that are involved. 4 major leukemia, types of leukemia. Number 1 is acute lymphocytic leukemia. And I believe it's not big English anymore, because I've explained 1 or 2 things concerning this. I see lymphocytic is the one that is coming from the white blood cell, right? We talked about the myeloid cells and the lymphoid cells, all right? So the myeloid, as it will grow to form red blood cell, blood platelet, and some type of white blood cell, such as basophils, eosinophils, and neutrophils, right? Then I also see that lymphoid cells will grow to form lymphocytes and natural killer cell. Now, when we talk of this classification or the types of leukemia, we say number 1 is acute lymphocytic leukemia, right? ALL. So in this case, this one comes, it attacks the body immediately before you know acute. Sorry if you are not familiar with this, acute and chronic. Chronic is something that takes time to develop, all right? Gradually, it has been there for a very longer time. But acute is always sharp. It will go destroy what you want to destroy, and you understand. So there is acute lymphocytic leukemia, means the one that attacks the body as fast as possible. Before you know, symptoms will come. The symptoms of it will show up. The person will be hospitalized, and if care is not taken, the person can even die as a result. But if a good treatment is being carried out, the person will survive it and live on. So the symptom will just show, all right? Begin to see fatigue, begin to see joint pains, begin to see swollen spleen, liver, stomach, all right? Swollen lymph nodes also, that alignment of liver, spleen, and so on. And swollen lymph node around the neck, under the arms, around the groin, and so on. We see many symptoms. So acute, we just come and hit, and the body will just deteriorate, all right? So acute, the one that comes very fast, lymphocyte, the one lymphocytic, the one that is coming from lymphoid cells, leukemia, all right? That's where it comes from, acute lymphocytic leukemia. Now, number 2 is chronic lymphocytic leukemia, of which I mentioned what chronic is, the one that developed over time. And let me say this, the acute one is very common, more common among the children, all right? You know, children will hardly have cancer cases, like all the colon cancer, you see cervical cancer, you see there's some of all these, even skin cancer. Children, they have not stayed that much on earth, of which you will begin to mention skin cancer and so on. So is one of the major, even though children have lower chances of cancer, this one is one of the major cancer of which can be experienced in children, among the children. So this acute lymphocytic leukemia is very common among the children. So number 2 of it is chronic lymphocytic leukemia. Now, this one developed gradually, all right? Gradually the system start deteriorating the immune system. The symptoms may not show for a very long time. It will be in the body and may not show for a very long time, all right? If not that you carried out some tests, all right, to know exactly what is wrong. The symptom may not come as expected. It will deteriorate the immune system. It develop gradually. In this case, some cells, I believe you can recall that we said these leukemia cells are always immature white blood cell that have a mutated DNA, right? So now that immature blood cell, sometimes they can a kind of mature and try to be like the other counterpart of blood cells, but still it cannot function well like the other good blood cells, all right? So it keeps a kind of trying, and as a result of that, keep multiplying, and it will be destroying the immune system. So chronic lymphocytic leukemia, I said about what lymphocytic is, the one that comes from what the lymphoid cells, all right? So which is number 2. Number 3 is acute myelogenic leukemia, or myelogenous. Let us put it in this way, right? Acute myelogenous leukemia. So what is this all about? Acute, you know now, something that happens too fast. The myelogenous, the one that comes from the myeloid cells, right? Which I said that myeloid cells can develop, a good one can develop into the red blood cell, uh, the blood platelet, and some type of the white blood cell, which is the basophils, the eosinophils, and the neutrophils, right? So now the one that develop from the myeloid cells, we call it myelogenous leukemia, all right? So acute myelogenous leukemia, the one that attacks the body very fast, though is a myelogenous, from a myelogenous cell. And the number 4 is chronic myelogenous leukemia. I believe you can actually explain this one by yourself from the examples we have been giving so far. And if you have any question, go to the comment section and put down your question. We are going to attend to it. I will attend to it. We have a lot of health personnel connected to this health community. I'm a healthy living health educator. With time, you are going to see more people in this health family. The goal remains the same. Let the world have a higher chances of survival. Let people live healthy life. All right, very important. Need to live healthier life. So it's a global goal. Now, we're done with the types, right, of leukemia, the four major types of leukemia. There is other subtype, but we cannot go there due to time. So now the next thing we'll go for, we discuss about the symptoms, the symptoms of leukemia, right? Yes, you can ask yourself, what are now the symptoms of this leukemia, right? What's the symptoms of this leukemia? How does it happen to someone? We need to understand this, that sometimes you may not show symptoms, such as something like those chronic ones might not show symptoms earlier, right? So those one that is that happen to people, especially that do above 65 years, and so those ones might not show symptoms quickly. So it's only the acute one that normally show a quick symptoms, right? Detectable one. So what are now these symptoms of which you can show if at all you are going to see any symptom? One, you are going to experience fatigue. All right, that is, you'll be tired too frequently, as in any small thing you'll be tired. Okay, so that is one of the symptoms. This sign is telling you, though other things, other illness can make you to feel this way. That is why you don't conclude on one. You need to listen to the whole symptoms, all right? Then you now know if you are experiencing one or two, all right? In fact, for curiosity's sake, you can go and run some checkups, all right, to be very sure, because if this begin to deteriorate your system gradually, like the chronic one, it's very dangerous, it can kill you. So that is, I say, number one is fatigue, all right? That is the tiring easily, okay? Number two is night sweating and also fever, sometimes fever, right? You can be having fever, maybe in a small thing, you have fever, you go and treat malaria, small thing, you go and treat malaria, be treating malaria, before you know, you take your blood group, you say is A. So okay, so in this case, let's say you check your genotype, you see A positive, you say okay, in fact I'm a relation to malaria fever, right? So, and you maybe check your blood, you see AA, and so on. So you say, yeah, I'm a friend of malaria fever. I'm a friend of malaria fever. In fact, that's why the thing is happening to me always. I'm a friend of malaria. So all the whole this thing, genotype, your blood group just fall under A. It's okay. That is the reason why my health keep deteriorating. That's the reason why I keep having fever. Not knowing that sometimes some fever might not be malaria, right? You need to kind of know what exactly is happening to you. Now, one of the symptoms, I say number two is fever or night sweats, all right? Sweating profusely. So it's good you go and do some checkups. Then number three is frequent infection. You have infection today, you treat it. You have infection next week, you treat it. You keep treating infection. Haba. It keeps coming because of what your immune system have gone down. These bad leukemia cells have taken enough space, so your body cannot fight any infection anymore. So it's one of the symptoms. Another one is that is a difficulty in breathing, right? You'll be having it, you kind of experiencing difficulty in breathing. You may not be able to breathe as easily as possible, right? Or as expected, right? Maybe having difficulty in breathing. So it's one of the signs, right? Or the symptoms. Now, another one is pale skin, right? Pale skin is this if you look at your skin, right, you see one patches as in whitening of some certain places in the skin. Your skin will begin to go lighter, all right, as if there is a lack of melanin, all right, on it, as if maybe the thing there's no much melanin on it. It will begin to go away from your normal complexion. You need to go and do some checkups. Very important, because your skin need to look the way it's looking. So if you begin to experience discoloration, unnecessary whitening of the skin, you need to go and know exactly what is happening to you. Another one of the symptoms again is unexplained weight loss. You are weighing 60. Before you know it, you begin to weigh 50. Within space of something like 1 month, wow, thing go down. Before you talk again, what is happening? 45. Before you know, 40. It's a medical emergency. I need to go and check out what is happening. You cannot just lose weight like that. No. All right. So unexplained weight loss is one of the symptoms, right? So now another one is bone or joint pains, all right? To be experiencing pains in the joint or bones, all right, and even tenderness, all right? You begin to kind of feel the joint somehow, right? There'll be inflammations of all those areas, especially if you have been taking maybe all these NSAIDs, non-steroidal anti-inflammatory drugs, you take, it's not working. So this pain, this one don't too take time. You need to check out what actually is happening, all right? So you need to be very, very sure of what's happening. Another of the symptoms is swollen lymph node, all right? That will tell you that something is wrong. Anytime I'm going to experience a swollen lymph node, right, like all those swelling that used to come around the neck, under the arm, around the groin, is telling you that the body is fighting something. Something is wrong in the system. I need to go for some check-ups to know what is happening, right? So swollen lymph node around the neck, under the arm, around the groin, all those areas. And also, there can be an enlarged spleen, right? The spleen, the liver, the stomach be enlarged. So you say, what is happening? This person, before you know, you can consult native people, they will give it one local name and say, what is happening? And so you may go and be battling with that one, not knowing that what's happening to you is actually simple. So if you don't have this information, how will you know? And suggest it to the people that are running the test, because they can decide to do other tests. All right. One thing is to have an illness. One thing is to diagnose a patient, and that thing is to do the treatment. When the diagnosis is wrong, just be very sure the treatment must be wrong. You cannot treat what is not the issue. And at the end of the day, you get well. It's not possible. So that's why I need to have some knowledge so that you can be able to suggest to healthcare personnel, right, the necessary thing they need to do so that they will do the right diagnosis. When they do the right diagnosis, then you can be able to know what you are treating. So when they do the right thing, if it shows that it's leukemia, you need to treat it. All right. So very, very important. Now, another one is bruising and also bleeding easily. All right. Everybody knows bleeds. All right. You bleeding from the gum, the nose, even under the skin. All right. So all those things are the symptoms. So you need to look at all those things. When you are experiencing that, you need to report. You need to go to health center and get diagnosed. All right? Very important. Now, let us go over what we just discussed about diagnosis, right? What we discussed now is symptoms, signs and symptoms of leukemia. Though it doesn't really show symptoms, especially in the chronic ones, but in the acute one, it normally shows symptoms. And these are the symptoms which we have listed. Now, let's go over to the next thing. Next, we are going to go now a diagnosis. How is it diagnosed, right? Okay, before we go into diagnosis, let's talk of causes of leukemia, all right? Causes of leukemia. So, just like I said to date, the exact cause of leukemia have not been known, right? So nobody knows exactly what is causing the leukemia, but scientists are just making some suggestion and still making some experiment to know exactly what the issue is all about and how to go about it. So, but there are some certain people of which we think have higher chances of developing the leukemia. One is those that have previous cancer, those that have had cancer before, so they have high chances of developing leukemia. Another one is those that are smoking. Those that are smoking. We have been talking about smoke. It can lead to lung cancer, but people are not still cooperating. They'll tell you you need to, something must kill a man. You are going to be there and you still die for just nothing. So it is recommended that you do the needful thing, right? You need to do the needful thing by stop smoking. So those who smoke have high chances because of what they have experimented this. Don't take this for granted. The scientists have actually experimented to keep, out of all these people that are coming to the health center, all right, for diagnosis, out of all these people that come in and are diagnosed, right? They come for diagnosis and they check them and they were diagnosed of leukemia. What and what? They have to take their history, their health history, and discover that many of them are people that are smoking, or maybe large number of them. And large number of them are people that have previous cancer. So that's why they are liking it to be say that people that have higher chances of developing this cancer, those who that is this leukemia cancer, is those who are have previous that is a cancer, and also those who are smoking. So let us take note of this. So those smokers are liable to die young. The company that are producing this cigarette is to write that smokers are liable to die young. People are still smoking. Now wait on. Thank you very much. You did try. Now let us continue for the sake of time. So other people again that have high chances of developing this is those who are exposed to some certain chemicals, some like benzene, formaldehyde chemicals. These two chemicals are very known to. All right, thank you. We are back. Sorry for the interruption. I know I interrupted the network. So another one is exposing yourself to some certain chemicals, some like benzene, formaldehyde. All right. All these chemicals are very harmful and they are known to cause cancer. They are contained in all this plastic of which we use, even detergents. Some are used in producing dyes. Some even are used to produce medicine. All right. So we need to be very careful in exposing ourselves. The one that they're used in producing medicine, at least that's why some medicine is carrying prescription only. All right, there is some certain reason why they have to put out prescription only. So that's by the way. So this chemical, exposing yourself to this chemical, harmful chemical, is very dangerous, and it can predispose you to this leukemia. Now the next one is a certain genetic disorder. All right, if you're having certain genetic disorder, you may likely have this leukemia. Some like Down syndrome, you see Klinefelter syndrome. All right, what is Klinefelter syndrome? Is a case of which the this thing, what are they calling it, in the gene of a man. All right, he have 46 chromosomes, right? So in that chromosome you have 46. There will be that is, which is X chromosomes is 46, and the Y chromosomes is X chromosome is 23, the Y chromosome is 23. So combining these two, it will become 46 total. But an addition of X chromosomes is a genetic issue, right? So an addition of X chromosome means the man will now be having YXX. So the chromosome will now become 47 instead of 46. Is a problem. Before you know, you begin to see where man is growing breasts, showing some certain kind of characters of a woman. Some people sometimes can be infertile, right? Because there will be a drop in the progesterone, right? In the testosterone, which is the male hormone, and there will be an increment of something like progesterone, estrogen, female. So female features will be showing instead of male features. It can make someone to become infertile, right? So that is some certain reason why some men are infertile. All right, so we need to learn this. So Klinefelter syndrome, and there's one we call that's a Down syndrome. All right, that is where there is a photocopy of the 21st chromosome. All right, of any gender is Y. Let's say in men now, X is 46. The Y, X is 23. Sorry, X is 23. Y is 23. Okay, so in women, X is 23, the second X is still 23. So, but in the 23rd one of the X or Y will now mutate. Will now a kind of there will be an addition of that one, a copy of that one will be a kind of added again. So the total chromosome will still be the 47. All right, instead of 46, there will be an addition of one chromosome, but the 21st one that is going to it kind of replicate itself, and it will lead to Down syndrome. All right, you see somebody having a short neck. All right, there will be some developmental issues. The person cannot develop properly as expected. All right, to that Down syndrome. So people that have a genetic problem may likely have this leukemia. Let me take us back again. I said leukemia before now, the cause is not known. No one knows actually what is causing leukemia. All right, but even scientists have tried to investigate it, but there are some people which have a high chances of getting the leukemia, which you have mentioned, those who have previous cancer, those who are smoking, those who expose themselves to certain chemicals, not like benzene and formaldehyde, and those who have a genetic problems, all right, such as Down syndrome, Klinefelter syndrome, and the rest. You get it? So, but you that are smoking, let me not. All right, now we are going over to the next thing on the line is okay, even the family history. Sorry, family history. But let us take note of this. In the family history, all right, it is not a must or compulsory that if somebody is having it in the family, so the relation or anybody around the family must have it. No, it's not like that. All right, so there is a high chances, but it's possible that if they are living a healthier life, a good life, that no one in the family might even have it again. You understand? So family history is still one of them. All right, so now next thing is diagnosis. How is this leukemia diagnosed? Right, so you can say, well, how is it diagnosed? We need to know how it is diagnosed. Okay, now number one is it physical exam. All right, the health worker will now kind of look at you. It kind of check your in fact, by presenting the patient to the healthcare provider, at least you know that something is wrong, because there will be an enlargement of the spleen and the liver, even the stomach, swollen lymph node. All right, so when you feel all these things, you know that something is wrong, and is telling that some things need to be done. All right, so physical exam is one of the way to diagnose this. Another one is a complete blood count. Complete blood count, very important. Complete blood count will help you to know the level of red blood cell, to know the level of white blood cell, to know the level of blood platelets, to check if all of them are normal. All right, if they are normal, fine. If they are normal, very, very fine. So means you are good to go. Means probably they need to go for other tests. But someone that having leukemia, we have higher white blood cell than normal. All right, what did I say? Somebody that having leukemia, we have higher white blood cell than normal. That is when you know that there's something that is wrong. All right, so that is it. Full blood count is required. All right, very important. So the next one about how you can diagnose it, another one is blood examination. So they will examine your blood maybe through microscope, using maybe flow cytometry, using the peripheral blood smear. All right, they will bring your blood, just like a microscope. So they will check the blood. All right, during the peripheral blood smear, they will check your blood, know the abnormal ones. So it's one of the ways to diagnose this leukemia. Another one is bone marrow biopsy. They will now extract some tissue in the bone marrow and check for these leukemia cells. I've told us areas you can see, especially areas you can see bone marrow, like the femur bone, the sternum, this area, even the vertebra, right, or the lumbar region. So, but now is recommended they extract from the pelvic bone. They will extract some fluids and check for these leukemia cells. And if they're able to see these leukemia cells, means you need to commence treatment immediately. All right. So that is it. Another one is even an image and other tests, that imaging, all these CT scan, X-ray. All right, they can use it to check your system to know what actually is happening. They will do imaging. All right, check your system, what is happening. Very important. Next one is lumbar puncture. All right, so they can check the fluids in the lumbar region to know that is the one that is covering the nervous system that is going down. So they need to kind of check that the central nervous system down from the brain spinal cord, carry go down. They need to kind of extract some fluid there to know what is actually wrong with the cells in that place. So call it lumbar puncture. So that is by the way. So we are going into treatments. So anyone that having leukemia, you can be treated, but take note of this, that leukemia does not have cure. Yes, presently it doesn't have cure, but we are trying to look at the aspect of stem cell transplant. Okay, stem cell transplant, whether it can kind of cure this leukemia. But before we reach there, let us see other treatment measures, right? So, but this treatment is just to manage the condition, right? Manage the condition effectively to avoid your health being deteriorated and the rest, all right? So, the one is a chemotherapy, all right? Then it kind of target the leukemia cells with some chemicals, such as drug, can come in injection form, all right? Is either you take, you swallow it, or they inject it through the vein or through the muscle to go and begin to kill the leukemia cells. All right. So after killing, sometimes it can come back, or which we are still going to look into that aspect. All right. But the aim is to use that chemicals to damage the leukemia cells, so that other cells will not have a balance to begin to grow and multiply and will return back to normal health. That is chemotherapy. Another one is immunotherapy. All right. This is using some certain medication to kind of boost the immune system. They will boost the immune system so that the immune system will now recover fully to fight the leukemia cells, so that it kind of fight it off by itself. So we call that one immunotherapy, immune. So boosting of immune system so that it can fight off the leukemia cells. Now, the number 3 of the treatment measures is targeted therapy. This targeted therapy is very important, it's very good, because for this one, they will target the leukemia cells, release the medication, it will go and begin to kill the leukemia cell. They will just target it alone. All right. So that is by the way, another one is radiation. All right, they can use radiation to actually kill this leukemia cells. They can use radiation is another way. Then another one, the last one, okay, no, not the last one, is hematopoietic cell transplant. That is one of which I say is a stem cell transplant. All right. So now, what do health workers do here? Before they do this hematopoietic stem cell transplant, the hematopoietic cell transplant, which is the stem cell transplant, what they will do, they will extract good cells from the bone marrow. All right, they will remove the whole this thing, go and save it, then use radiation and destroy all the whole cells. Are you getting me? When they destroy the whole cell, they will now infuse that good one back. They will now infuse that, they will destroy the bad ones. All right, all the whole leukemia cell, they will destroy it through radiation. Then after destroying through radiation, they will now infuse that good blood cell back. So once they put it back, the body will now kind of take it, begin to work with it, and before you know, through cell replication, before you know, the body will now bounce back. It will multiply and take over the system, and your immune system and everything will come back normal. All right, so that is the essence. So before they do this stem cell transplant, they're supposed to remove the before they do this stem cell transplant, they're supposed to they can, okay, let me let you know about this. They can actually use the cells of the same person, or they can even get from a donor. All right, donate stem cell, or who they are going to put in the patient. So before this stem cell transplant, they must have destroyed the bad ones, so that when they put that good stem cell, it will now develop and make the body to recover. So take note of this. I said it. I say if you have question, you have to put it in the comment section. All right. We have a lot. We have discussed a lot. All right. Right. So we have spent more than an hour now, but we still have little to complete this topic on this that is about this blood cancer. Now let us go straight to phases of leukemia treatment. Right, there are different phases of leukemia treatment. I think that is the last thing we are going to discuss. Then we call it a day. We are still going to host other things concerning different topics. Let us have idea of different things, right, of which will help us. Just like I said, this channel, it welcomes everyone, both the healthcare personnel, both individuals that want to know more about their health and the health of their relatives. Very important, because sometimes there will be a wrong care that people will give to you. For instance, like I mentioned, many signs and symptoms of this leukemia, which I say fatigue, even difficulty in breathing, even pale skin, even bleeding or bruising easily, even joint pain, even a frequent infection, even unexplained weight loss, and the rest, fatigue. So some people might be having all these issues, but they don't know that possibly this might be the cause, because they don't have the idea, they don't know. And you can go, maybe you go to primary health center or maybe general hospital, they might not, their mind will not come to that aspect. They will just tell you the first thing, if you go to a health center, the first test of what they are going to run for you these days is typhoid and malaria, because that is our friend, right? Typhoid and malaria. So you need to have the knowledge of other things. If this typhoid and malaria thing persists, what else can be the cause? Lab scientists, please, you need to do the needful, because the health of the people are being challenged. All right, wrong diagnosis, wrong treatment. Good diagnosis, good treatment. Take note. Now, phases of leukemia treatment. The number one phase is induction phase. All right, so induction therapy. In this induction phase, they will do remission. So they will use drug or injection to destroy the leukemia cells. Just like I mentioned, I said they can remove the good cell, right? Use radiation, kill the remaining bad cell. Then they will now do a transplant. They put the good cells, which will now help the body to recover. All right. So this is induction. All right. They will now do that one. The aim of this is to kill all the whole leukemia cells so that your body will be free. You can function normal like any other human being. That's the aim, and that's what it's doing. That is the first phase, induction therapy. The second one is what? Consolidation. That is what is we name it, but I will put it this way: not it's just like intensifying. All right, as in, say this thing I did, let me intensify the work in case of any failure in treatment. So they will use that consolidation treatment phase, which will last for some months. All right, they will use it to a kind of help the person so that leukemia cells will not develop again, so that it will not come back. There will not be relapse in the treatment. So they use that one, consolidation, to kind of intensify the effort or the therapy. That is number two. It has just three phases. Number three is maintenance phase. All right, maintenance therapy. So that one, it can even take you up to 2 years. You understand? Be taking it for up to 2 years and so on, to make sure that what you are able to maintain your system within the period, to make sure that your body is functioning normal. So you'll be taking the drug, or maybe it's too short, you'll be taking it for up to 2 years for maintenance. So mind you that leukemia, I say as it stands now, it is not still curable, but they are still working on it. All right. So like if they do this stem cell transplant, sometimes somebody can stay for years without experiencing it again. Some people might not even experience it again, but majority of people, it will still come back. That's why they say for now there is no cure for it. So you need to take that maintenance for 2 years, then you stop. So in case if there is any surfacing of the leukemia case again, what will you do? You have to go back and start over, do induction treatment, you do a consolidation treatment, then you continue the maintenance phase, right? So if you check the whole thing, the long story cut short is that blood cell, discuss about blood cancer, or which we say it have 3 different types, which is the lymphoma, the myeloma. We have the lymphoma, right? The myeloma and the leukemia. All right. So what we discussed today is leukemia. Leukemia, we have mentioned different things about leukemia. And just like I said from beginning, you can say this issue, because if you mistakenly go and ask Google or Chrome or Phoenix, say what's the prevalence of this leukemia, you can tell you is not that is common among the white, is common among those who are above 65, is common among the men, and so on. It will actually tell you something, but we're looking at about the practical aspect, right? Just like I said, there is some certain group of health workers have to conduct this experiment, do some tests, and they kind of take the statistics. Sorry, maybe it might be those who are into biostatistics, right? So they have to check how common it is in one state. So they were recording about up to 95 cases or thereabout for one state, of which among them majority are that is elderly people, right? Children are just very few. So in that experiment, though the case for one state is about 95, so means it's gradually a kind of coming, So of which we took how do we do, what do we do to prevent this? What do we do to prevent this? All right. On our part, please stop smoking. Those who are smoking, share this information to your loved ones. Anyone that is smoking, stop smoking, please. Very important. Stop smoking. It leads to many cancers. Not only this leukemia, lung cancer is there. All right. And also keep away from some certain chemicals, right? Especially the one that comes from household. I know there are some things of which cannot do without. You cannot say because of the chemical in detergent, you are not going to use it. But if you after using it, wash your hand properly, or if possible, you can wear a glove. If you can wear a glove while using it, fine. It will help. So just decrease that exposure to all those plastics, right? Dyes and so on. So all those things are harmful to your health. All right. So take note of this. Take note of this. Benzene, formaldehyde. All those things are dangerous. They causes cancer. They are chemicals that cause cancer. All right. So I think we have come to the end of the class. Thank you very much for being part of this life. Any time of which you watch this class, maybe on this YouTube, and you feel like you did not understand some aspect of this class, let me know. So I can explain to you. All right. So this blood cancer is dangerous and is deadly. So let us do the needful thing. All right. Things of which we can do on our own part to prevent this, and let us take note of this before we begin to lose life as a result of this cancer. We need to just know exactly the symptoms of this, so that if such symptoms, maybe about 5 or 6 of this kind of, especially this enlargement of spleen, liver, stomach, swollen lymph node, all right, all these pains in the bone and joint, tenderness, uncontrolled weight loss, all this fatigue, all this chest pain, all this difficulty in breathing, pale skin. So if you combine all these symptoms, say, something is wrong. All right, you don't need to rely on all these. You need to have this idea so that you go for thorough checkup. All right, so that you know exactly what happened. Then they start treatment on time. Early treatment lead to early recovery. And if you did not do treatment on time, somebody can go as a result. When you are treating malaria and typhoid, and not malaria and typhoid. So thank you very much for being with us on this live. We are going to do other live. So share this video to your friends. Share this to your family. Those you want them to benefit from this live, or which we'll be doing from now on. We'll be doing normal video anyway, but still we'll be hosting live. So that from it we can learn more. In the normal video, can just run like 1 minute, so 2 minutes before you know the video is getting too long. But with this, we can explain many things. All right, this is something that's supposed to take us 1 week, 2 weeks to explain the short videos. So you have exhausted it today. So stay tuned. Share this if you have maybe health groups or which one into. Send this link, send the video to them, let them watch. If they have any question, let them come and paste it under the comment section. We have a lot. All right, so we can answer them, and we can use it and even create more live. All right, so it's going to help us. So just like I said, the goal of this particular family is to make sure that we arrange good health workers, we train good health workers. Trust me, when it comes to in health, I don't know it. Even the highest person, that in fact the most intelligent health personnel, you don't know what in the health, half of it. So who am I? I don't know it all, but I'm trying my best. So we train healthcare personnel here. All right. So you can ask me a question. I say, Just ask me any question of which you wish. I'll answer you. I'll give the necessary answer of which you need. All right. If you're not satisfied, we can consult other higher people. Like I said, we have many health personnel under our family, pharmacists, doctor, we have dietitian, in fact, any nurses, we can psychiatric. So any challenge, we can consult another health worker, right? Which will help us out. I don't know it all. So, but we have this goal to build a healthier family. Very important. So share to people. Let people come and join us so that we achieve this goal. Thank you for staying with us. I remain Health Educator Mike. Thank you and remain blessed. Happy Sunday once again. Thank you.
Thank you. Yeah.